what is buffering a local anesthesia? Well, those little glass cartridges that we use with the solution in it, the numbing solution, whether it be lidocaine, articaine, or a number of others, is prepared very acidic. And the reason why it's made very acidic in the little cartridge is because that helps with shelf stability. It helps it maintain its ability to sit on a shelf until we're ready to use it. But it's very acidic. And if you can imagine injecting an acidic solution, that can kind of pinch and burn and sting. And it also accounts for how slowly it works. And if we can change that pH to be more neutral, like our bodies are, 7 to 7.4, we can take care of some of that stuff. It doesn't pinch, burn, sting. It works faster. And then because when things are more neutral, in this case, they're also more lipophilic, they cross the nerve membrane, it works better.
What's going on, everybody? John Stamper with John Stamper Media, and very excited to be spending a little bit of time today with Dr. Jason Goodchild, who practices, we were just speaking, 28 years, right? Who's counting? But certainly does set the stage for this conversation. He's been there, he's done that, he's seen his share of materials and products and all of that. And Jason, we were just speaking kind of on the outskirts of Philly is where you practice?
That's right.
Awesome.
And I thought you were going to say like 25 plus after, all these years, but 28 is precise.
I love it. I love it. All right. So we want to jump in here. The whole goal of the conversation today is around Septodont's product, BufferPro, and wanted to get your thoughts on it, kind of the use and the application of it, like where you see the benefits of it. And as you know so well, Jason, dentists out there that are looking for products that they're going to use in their practice, always beneficial to hear from other clinicians. So I thought we'd start there.
Great. There's a lot to talk about with buffering, but I think maybe like a step back to give a little context would be helpful, right? There's a lot of things that patients don't love about coming to the dental office. You could the smells, the sounds, the actual dentistry itself. But one of the ones that tops the list for most people is the local anesthetic injection. And, that's one of those kinds of processes in the dental office that you just don't get to do the rest of it until you get that part done, meaning you don't get to get that cavity filled or a crown or root canal or anything else until that part is right. And so it becomes a very important sort of gating procedure for a lot of patients. And I would say that most dentists, most hygienists that are doing local anesthesia, they're excellent at it. They wouldn't be in practice if they weren't very good at it. But there are always those hard to numb patients that are really nervous or, nervous and hard to numb, or, it's just a problem for them to receive it. So what if you could create a situation where the whole process was made easier, meaning it was less painful, it worked faster, and it actually worked better, meaning the numbness that you got was more deep, it was more profound. It helped prevent any procedural pain even better than what you'd experienced previously. So those three key benefits, right? It doesn't hurt as much when you get the injection. It works faster and it works better, are the kind of benefits that you could get from buffering your local anesthesia.
So when I think about, like you mentioned, patients coming in and maybe not wanting to get a particular procedure done, even though it's recommended to them that it's better for their oral health and all of that, this becomes a hang up many times, doesn't it? I'm sure you've seen it in your career where, the patient needs to get this care done, but for whatever it's worth, it can be difficult to do that. So I love kind of those three ideas of setting the stage like that.
Yeah, when you ask a dental professional, like, why don't patients follow through with the treatment that's been recommended? There's lots of reasons. Sometimes it's fear. Sometimes it's they don't understand the value because in dentistry, we recommend things that a lot of patients can't see or feel yet. That's the preventive side of it. Let's take care of little problems before they become bigger problems. And then, of course, there's cost. But when it comes to fear of not being numb enough, or fear that it's going to hurt when we do the local anesthesia, that is where buffering comes in. And I think a lot of dentists, hygienists would agree that if you're really good at that, meaning my dentist gives the best injections, I never feel anything, and I'm just so numb. That's a practice builder for a lot of offices.
Yeah.
The reverse is also true, right? You don't want to be the dentist who, oh my gosh, they give the worst shots. He's a great guy or she's a great dentist, but oh my gosh, that part is terrible. Wouldn't it be better for everybody? The patient experience, the efficiency of the dentistry. I mean, I'm a dentist, and when my patients aren't numb enough or comfortable, it makes me nervous because I don't want to hurt them too. And
Right.
so that's where, again, enhancing local anesthesia with buffering is really good. And then let me define it for you. I mean, what is buffering a local anesthesia? Well, those little glass cartridges that we use with the solution in it, the numbing solution, whether it be lidocaine, articaine, or a number of others, is prepared very acidic. And the reason why it's made very acidic in the little cartridge is because that helps with shelf stability. It helps it maintain its ability to sit on a shelf until we're ready to use it. But it's very acidic. And if you can imagine injecting an acidic solution, that can kind of pinch and burn and sting. And it also accounts for how slowly it works. And if we can change that pH to be more neutral, like our bodies are, 7 to 7.4, we can take care of some of that stuff. It doesn't pinch, burn, sting. It works faster. And then because when things are more neutral, in this case, they're also more lipophilic, they cross the nerve membrane, it works better.
All right, so then let's talk specifically about Buffer Pro on this concept of buffering in general and what you like about it and how you see it being something that obviously helps this type of procedure.
Yeah. So again, dentists are creatures of habit. If you've ever been to a dental office, sometimes they look like they're from like the 70s and 80s. Like we just, we stick with what works. And when we give local anesthetic to folks, and by the way, local anesthesia and dentistry goes way back to like the 1880s. And then there was Novocaine, and then there was lidocaine in the 1940s. So there's a long history of using a local anesthetic to numb before a dental procedure. And in all those years, the procedure, the way we do it, is very ingrained. We have a standard armamentarium, which is a nice way of saying we just have everybody uses the same kind of equipment. So we've got the needle, we've got the cartridge of the solution itself, and then we've got this metal scary syringe that we use. And that's what everybody does. When you want to introduce something new into that process, it's a little slow to adopt. So buffering is not a new idea. It's been around for a long period of time in medicine. But to get it into dentistry hasn't always been so easy because we got to crack that standard armamentarium code. So there are other products that can do this. There's a kind of a DIY approach to it, which is kind of standard vial of bicarb, and you draw up some and you inject it into the little glass cartridge. But the game changer, the home run, came from, I believe, Septodont's BufferPro. And some of the things that they overcame with buffering was that they made it so simple, really easy. So the trick to adoption is simplicity, right? Let's make it so easy that there's no reason not to do it.
Right.
But we also came up with something like it's a single patient use. It's sterile. It's affordable. It's just like this little thing that makes it so easy to introduce the sodium bicarb into the cartridge. So, all that history aside, the game changer is something that makes it easy. You can actually delegate it. Like as the dentist, I can say to my dental assistant, "Hey, I'm going to give local anesthesia to Mrs. Smith." And I know Mrs. Smith, she's a natural redhead. She's always hard to numb. She has an infected tooth. So I want to do my very best and pull out all the stops to make sure that she gets numb. And so I would tell my dental assistant, "Yep, we're going to buffer this case with BufferPro." And my dental assistant can actually do it and then load all the little parts and pieces. And I'm ready to go as soon as I sit down.
And what has that experience been for you? Like when I mean, how long have you been using it? Like how long has it been a part of your honorarium or not honorarium, but like is,
Your
for your,
armamentarium.
yeah, armamentarium. There you
Yeah,
go. Yeah,
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 all these big words.
yeah.
Yeah. So I've been buffering for years and years. I actually did some research, some chairside benchtop research on, how to do it. What's the right recipe for sodium bicarbonate to solution? And then we tested over time. I mean, this has been an area of real interest for me for a lot of years. And then when the folks at Premier Dental and then Septodont, who are selling it, sort of designed this little so easy device to do it, to put the sodium bicarbonate into the cartridge. I mean, I've been playing with it nonstop. I mean, to me, I think this is where we started from. I just think that we can make the patient experience better, right? I've never had a patient complain to me about being too numb.
Right.
but I certainly have had patients complain that they're not numb enough.
Yeah.
And so I want to be the guy that says that I'm good at this. This is my thing. Patients are going to be really feeling super numb and ready to go. I buffer everything. I'm a big believer in the fact that we can do even better when we can create a better patient experience through better local anesthesia.
Well, and for all the dentists out there, or really dental assistants, or anybody that's watching this, you shared as part of this conversation how important it is to make it simple in order for them to switch what they're currently doing, or like you said, take on a new step in their procedure to be able to have this be a part of the buffering process. So, for any dentist out there that's watching, what would you share to them as far as learning curve, as far as building this in so that they can feel confident to know that, okay, I haven't done this in the past, but if I am going to go down this path and it's going to help
Yeah.
the patients more, what would you recommend?
It's a great question. So again, I mentioned dentists being creatures of habit. And so sometimes you need to hear things a number of times before you're like, hey, I might like to try that, or let me learn more about that. And I believe that Septodont has some really great resources to be able to not only explain what it is, talk about the potential benefits that the patient could get. And I keep saying those three benefits, right? It's doesn't hurt when you inject, it's quicker acting, and it works better. When you see all that stuff and there's videos of how to do it and how easy it is, and you see the little package that it comes in, it's shelf stable for 2 years, and um, maybe you only use it for those hard to numb patients like I described, but I just believe that local anesthetic buffering, it's not a new idea, but its time in the sun is here because BufferPro has provided such an easy solution to jump in. And I believe that the initial investment, sort of like barrier to entry on this one's pretty low. I mean, you're
Yeah.
talking about a box that is, I believe, retail, I think, and this isn't really my area, but I believe it's like under $100 to get started. And I mean, in my office, I've spent a lot more on a lot less. And so I
Yeah.
think it's a really neat investment to try, see if it works for you. Is it an every injection kind of thing that I buffer my local anesthetic, or is it like, hey, I keep it in my back pocket for those all those patients that I know are hard to numb. But it's just one of those things. And I keep mentioning that dentists being sort of creatures of habit. And one of the things I always say to dentists is, well, every dental clinician, every medical clinician, most people in their careers know that lifelong learning is a part of being a part of the profession. And if a dentist was to say to me, like, hey, I'm doing great with my local anesthetic, like, I don't need any help because we're sort of, they are good at it and we're stuck in our ways, I would say something like, well, yes, I know that you're good at it, but what if I could show you something that could hopefully make it better? Take it to another level that didn't exist without this cool new science of buffering. Would you at least give it a try? And to me, again, if your dentist tells you that I've never had any problems getting anybody numb and I get everybody numb as I want to every single time, well, they're not being completely honest because everybody's different. Everybody needs something a little different. And that workaround could really be important for some people who have always had a problem getting numb enough to receive the care they need. So keep an open mind. It's a cool technique. We made it super, BufferPro makes it super simple. And I'm just a huge supporter. I mean, I love it. I mean, I think the science is cool. The device, the engineer that came up with it was a genius. He is a genius. And so it's just a neat thing to make. And again, at the end of the day, we're all patients. As a dentist, I'm still a patient. And when I get my dental work done, I want the operator to use buffering when they inject me.
So, Jason, the last thing I want to ask you is you talked about in the case of giving the local anesthesia, like taking that to the next level. Could you talk about the delta, meaning like a dentist that is currently doing it, but then you mentioned taking it to the next level? Could you define a little bit of what that looks like and how Buffer Pro really kind of helps accelerate and take that particular procedure or experience more than that for the patient to the next level?
Yeah, so that's another really good question. So I could do it two ways. One is just anecdotally, and the other I'll try to attach a number to, actually try to quantify what we might be talking about. First, anecdotally, I would say that historically, when dentists do anesthesia, Right? They may sit a patient in the chair, they may administer the local anesthesia, and then after they've done that, they may sit the patient back up and say, "Hey, I'll be back in a few minutes after you get numb." And that, from a workflow perspective, allows them to kind of walk around the office, maybe do hygiene checks, do other things that they may need to do, and then give themselves like 5 or 10 minutes to come back, and the patient hopefully is numb by that point, right? I don't know if you've been through that before, that 5 to 10 minutes where you're like, "Am I
Yes.
starting to feel
Been
numb?"
there.
You're
Yes.
waiting for it, right?
Yes.
Right? But when I've been buffering, it's very common that I withdraw the needle from the patient's mouth, and then I'm sitting the patient up to do what I always do. And then all of a sudden they'll say something like, "Oh my gosh, doc, you really, you know, bullseye today. I'm already numb." And that just for me, it was always like, wow, that's the power of, and it's not the product, it's not
Yeah.
BufferPro, it's the science of buffering, what
Yeah.
sodium bicarbonate and a neutral pH can do here. But I've seen that so many times. I've seen it where, even skeptics, well, doc, it always takes a number of injections for me to get numb. And I say, okay, we'll see how we do. And even when I'm sitting them up after the first injection, that they already like, wow, that really is numb. So it's just so much faster. And I really have never had a problem with injection pain. But for people who are really nervous about it, my goodness, the idea of not feeling the injection and then feeling the numbness really quick has been a powerful tool. Then they can trust their dentist. This guy seems to know what he's doing.
Yeah.
Some metrics, though. There was an article from the Journal of the American Dental Association. I believe it was 2017, 2019. The year doesn't matter, but it was a cover story where they were looking at the use of buffered anesthesia to achieve anesthesia in pulpally involved teeth. And in the dental world, that means like, hey, there's something affecting the nerve and blood vessel of the tooth, and there may need to be root canal therapy. In these kinds of teeth, they're very hard to numb. They're because of the presence of infection or inflammation, it makes the local anesthesia harder for the patient. These are just hard to numb patients. So they studied buffered local anesthetic when used on teeth that were potentially pulpally involved. And what they found was you had about a 3 times better chance of getting numb, getting those patients numb. I believe it was 2.3 to 3 times better chance of getting them numb. And that was really powerful evidence, which means, to me, it means stacking the deck in your favor, which is taking what we already do, adding some science, the science of buffering, neutral pH, providing those potential benefits, in this case of more effective anesthesia, in those hard to numb teeth. And so to me, that one has always kind of stuck with me because you took the worst of the worst and you still gave yourself basically a 2.5 to 3 time better chance of getting the patient numb. And so again, people always ask me, they'll say, "Jason, well, do I really need to buffer? I mean,
Yeah.
you've had good success before, but wow, you could really stack the deck in your favor going forward with all these potential cool benefits. What's the downside? Is there
Right.
any downside to buffering? No, because it doesn't change the solution that we're already giving, right? If you're giving articaine or lidocaine, it doesn't change that solution. It just makes that solution more accessible, working better for you. The only potential downside is cost, in my mind. Because BufferPro is so easy to use. I mean, you really can't mess it up. It's just a push those two things together and the bicarb is injected into the solution. So the cost is potentially the downside. But again, the question has always been for me, if it's $2.60 or I can't even remember what it is, 250,
Right.
$2.50 additionally, what's the cost of not getting patient numb, or what's the
Yeah.
cost of waiting to actually have to do it again because it didn't work the first time, or what's the cost for the patient who says, um, geez, I love my dentist, but he can never get me numb.
Right.
I mean, so all of those potential costs, 250 is a
Yeah.
small drop in the bucket.
Well, I'm glad you shared both of those, both the anecdotal side and then, of course, the scientific side. And one of the things that struck my mind when you talked about the cost piece of it is I think about the cost of the patient experience, and I think about how much more, as you know so well, Jason, that patients are talking more about their experience at the dentist. I'm hoping that since COVID, more and more patients are seeing the, the oral systemic link and the connection between our oral health and everything else in our body. And, a gateway to that, like you mentioned, are these little tiny things that I think a practice can do in an effort to move that patient along if they feel that much more comfortable to get this done. And, one little thing of feeling numb or getting numb quicker, like you mentioned in that anecdotal example, that goes a long way. And I kind of think that's kind of hard to put a price on, right? I mean, that is the confidence that you're building inside your practice. So love both of those examples. Great stuff. So.
Yeah, no, that's exactly right. It's this again, like I mentioned, there's so many reasons why patients don't follow through with their treatment. Let's break down those walls and make it more accessible so that they can feel comfortable getting the work they need to have done. There's trust and rapport between the provider and the patient, and that's a win-win.
Yeah, absolutely. Well, Jason, thanks so much for your time. I know the team at Septodont really appreciates it, and I know the Dental City team is excited to bring about this type of conversations with clinicians like yourself and talking about not only the products that you use in your practice, the materials and the tech and things like that, but more importantly, like what's the why behind it? Like what did it take for you to really believe in this, and most importantly, create a great patient experience? So thanks for your time and really appreciate it.
Thank you, John.